Let's talk about ketosis in cattle. Ketosis is a disease of cattle, buffalo, sheep, and goats oftenly, and it is a disease which is characterized by impaired metabolism of carbohydrates in the body of highly milk-producing cattle. Most probably occurs after following parturition, 4 to 6 weeks after parturition, when there is peak yield of lactation in animals. And the disease mostly is characterized by acetonemia, ketonuria, and ketonemia. Means there is formation of ketone bodies in the animals. Now, whenever the animal is subjected to negative energy balance, then the chances of ketosis is most probable during that time. Negative, by the meaning of negative energy balance, I mean to say that when the energy requirements of animal are not met either by nutrition or due to any pathological disease. Now, there can be insufficient supply of carbohydrates, which can be the reason for the development of ketone bodies, or there may be or any reason which results in anorexia, such as any metritis, endometritis condition during the pregnancy time or during the dry period time, or after the parturition, or any hepatic insufficiency, followed by if the silage we are providing it is having more of the butyrate, that is ketones, in the body, and certain deficiency of certain vitamins such as minerals and vitamins. Among the minerals like cobalt and phosphorus deficiency, they also make animals susceptible to development of ketosis. Now, what happens actually when there is anorexia in animal, then there will be decreased glucose inside the blood of the animal. Then when there is decreased glucose, there will be decreased release of insulin. But on the other hand, there will be increased cortisol and somatotrophin release, which results in mobilization of body fats to the liver. And when there is mobilization of the body fats in the liver metabolizes those fats into fatty acids and glycerol. Now, these fatty acids and glycerol is purely responsible for the development of ketone bodies when there is lack of glucose precursor. Now, actually, let's see what happens during the normal glucose metabolism of the cattle. When carbohydrate is given to the animal, it metabolizes to acetate, butyrate, and propionate in the ratio 7:1:2. Now, acetate is used up in the formation of the fats, whereas butyrate is used in the formation of beta hydroxybutyric acid, which is absorbed from the rumen epithelium as such. But the propionate, it is the main precursor for the formation of glucose to meet the energy requirements of the animal. Propionic acid and amino acid, they combine to form propionate, which undergoes metabolism inside the liver to form oxaloacetic acid. Now, this oxaloacetic acid is required for the metabolism of acetyl coenzyme A to form the glucose. When there is deficiency of the oxaloacetate, then what will happen? Then this acetoacetic acid then this acetyl coenzyme A is metabolized to ketone bodies such as acetoacetate and beta hydroxybutyrate. Then acetoacetate, acetone, and beta hydroxybutyric acid, they are the major ketone bodies which are responsible for the formation of ketosis. Then in the rumen, it will metabolize to isopropyl alcohol, which will cause the nervous signs of ketosis. Now, there can also be a subclinical form of ketosis in which there is only ketonuria and no other clinical signs. Even the glucose level inside the body of animal is also normal, and there is only a higher BHBA if we measure the serum BHBA in serum of animal, then it will also only rise to a certain extent. There will be no clinical signs. It is also called type 2 ketosis. Now, for the clinical signs, there can be waste signs of wasting, such as animal would be woody appearance, because all the fat from the body will be metabolized to the liver, and with the progression and more formation of ketone bodies, there will be nervous signs such as ataxia, stargazing posture, circling, head pressing, and tremors sometimes. Conversions are mostly seen in sheep. Now, diagnosis part, we can diagnose it from the clinical signs, because there will be a fruity smell in the breath of animal, fruity smell from the urine of the animal, and blood glucose level, there may be hypoglycemia. Ketone levels of blood are raised, are more than 30 milligram per deciliter. Urine more than 80 milligram per deciliter, and milk also. We can also perform Rothera's test, in which we just have to take a 5 ml of urine sample, then we have to add a pinch of Rothera's powder, and then add 1 to 2 ml of liquid ammonium hydroxide. There will be formation of purple ring, so it marks the presence of ketones in the urine. Now, regarding prevention, being a animal, being in touch with the animal husbandry, one should know how to prevent this disease. This disease can be prevented by proper management and care. By proper management, I mean to say that adequate highly digestible carbohydrates should be fed during the dry period of the animal, and concentrate feed should be increased 4 weeks prior to the calving, apart from the maintenance diet. About 1 kg of concentrate diet should be given per 3 to 2.5 to 3 kg of milk. Monensin has been shown to be helpful reagent in the prevention of the disease, so about 25 milligram of monensin can be added to the feed. And daily supplementation of sodium propionate around 110 grams for up to 6 weeks daily is also helpful in the prevention of the disease. Moreover, only fresh and good quality of roughage and concentrate should be fed to the animal. Highly digestible carbohydrates like maize and oats should be given to the animal. And any stress, reasons for any stress during the dry period and post calving period should be minimized. In the herd level, if we are able to see that the body conditioning score of animal is consistently falling, then we should follow up for the veterinary advice, and should see a doctor as soon as possible. Otherwise, on a farm, we can regularly monitor the blood glucose levels in our animal. And nowadays, even beta hydroxy, even meters for ketone meters are also available in the market. So BHB levels can be checked. They will give a rough idea about the ketones, formation of ketones inside the body. Thank you. That's all for ketosis.